Our endeavor is to spread awareness about rabies, which is fatal but can be avoided once appropriately vaccinated. There is an initiative from Cadila through its innovation to serve the society and humankind. The topic of the webinar is dosage reduction strategy in rabies management, role of novel vaccine. Dear Doctor, rabies is the world's first novel 3-dose anti-rabies vaccine, and great pride, we would like to inform you that rabies has successfully completed 1 year of launch with more than 40,000 animal bite victims being vaccinated. 100% compliance was recorded and no case of ADR was registered. With this, it is my honor to introduce you to the speaker of today's webinar, Dr. Satish Chandra Misra, MD Medicine, practicing in Durg district and having a 36 year of experience in various patients. So now I would like to request Dr. Satish Chandra Misra sir to initiate the talk, and later on we will have a question answer session, sir. All the participants can drop their question in the drop box, and we will read out all the questions after the presentation. Satish Misra, sir.
Good evening, everybody. I am Dr. Mishra. Today, I will speak about the ultimate key for compliance novel 3-dose G protein vaccine. Yes, good morning. Good evening, everybody. I am Dr. Satish Chandra Mishra, MD Internal Medicine from Manipal, practicing in Durg. And today, I'm thankful that I'm going for about now 3-dose G protein vaccine, which is the ultimate key for compliance. We know that globally, 59,000 human deaths annually, which is highest in India due to rabies. India has 20,000 human deaths a year from the rabies, accounting for 60% of the rabies deaths in Asia and 35% globally. 91% death in India occurred in rural area. This was given in a PCRI journal. We know the current management. First aid is local wound treatment. Suppose a big wound is there, we wash it immediately for 15 minutes with soap, water, and disinfect it. Then we vaccinate for their schedule. Active immunization in the form of vaccine and passive immunization in the form of immunoglobulin. 5 doses of SN intramuscular regime for 5 visits. 1 dose intramuscular dose of vaccine on day 0, 3, 7, 14, and 28. For the category 2 or 3 exposure, wound toilet is very important. Then RIG in the case of category 3 exposure is very important. Vaccine is administered in intramuscular in deltoid, upper arm, or anterior lateral aspect of thigh only, never given in the gluteal region for the purpose of immunogenicity. Non-compliance, current rabies vaccine are cell culture vaccines. Inactivated vaccine are more than 50 years old technology, inconsistency in potency, stability, availability, short supply, and adverse events. compliant who receive the full course of anti-rabies vaccine, that is the scheduled dose of anti-rabies vaccine on the recommended date. Delayed compliant who completed the scheduled dose of anti-rabies vaccine within 60 days but deviated from the scheduled regime. Dropout or non-compliant who had taken at least one dose of anti-rabies vaccine after animal bite but not completed all the scheduled dose. The reason of death may be due to lack of administration of the rabies immunoglobulin or poor compliance to vaccination. Compliance to post-exposure prophylaxis among animal bite patients, a hospital-based epidemiological study was done in Department of Community Medicine, Vardhaman Medical College and Safdarjung Hospital, New Delhi by Mansi Panda and Usha Kapoor. 53% was non-compliant to the full course of anti-rabies vaccination. Compliance of anti-rabies vaccination in a post-exposure prophylaxis done by Ravish Hardnasai at Municipal Corporation Hospital in Bangalore, in which 215 animal bite patients were there, and they are immunized day 0, day 3, 7, 14, and 28, from 0 to 100 compliance. And this, all the graphical representation was there, in which the compliance rate for the intramuscular rabies vaccination was 60% on day 28, which is marked by the red color. Interfering with the school timing in 11% of the patient, distance of the hospital in the 11%, and cost incurred 13%, and forgotten dates 18%, and loss of Vegas 47%. These are the major constraints for the compliance to complete the anti-rabies vaccine was loss of Vegas 47%. Evolution of the vaccine from the nervous tissue and the cell culture. In earlier days, in 1885, 1911, and 1976, live attenuated vaccine from the spinal cord, and this is non-standardized dried preparation up to 31 injection of increasing immunogenicity. And after 1911, the inactivated vaccine, minimal neural content, lipid preparation, 14 injection, each 0.5 ml daily. My experience for this 14 injection for 0.5 ml daily, earlier days when we passed the MBBS in 87, and at that time the head of the brain of the dog sent to the Sagar laboratory to see the Negri's body. And after 76 cell culture inactivated vaccine, in which cell culture is more than 2.5 international unit, and standardized immunogenicity lyophilized 5 injection 0.5 to 1 ml 0, 3, 7, 14, and 28 days. Non-compliance led to evolution in treatment regime from 31 dose to 5 dose and still on. Meeting the unmet medical need, introducing a novel vaccine with simple and shorter regime. 3-dose recombinant G protein vaccine, novel 3-dose recombinant rabies G protein vaccine, first protein subunit vaccine prepared by VLP platform technology, and first vaccine with 3-dose intramuscular regime, 0, 3, 7 days, better compliance due to easy to flow regime and less visits, and convenience, ready to use, no reconstitution needed. Native virus. G protein is difficult to stabilize. G protein isolation using the VLP technology, purified and stabilized by the pharmaceuticals, and virus-like particles are protein complex, exist as nanoparticle, and VLP are similar to native virus particle, but they do not contain the viral genome. They cannot replicate but can mimic the viral antigenicity without being pathognomonic. They are capable of inducing a strong humoral and cellular immune response, and VLP as a vaccine is using. Safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as simulated post-exposure immunization, a randomized comparator controlled multi-center phase 3 clinical study was done to evaluate the immunogenicity and safety of the rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteer and randomized comparative controlled multicentric study total 800 subjects with randomization of 2:1 thyroid base was done in 0-3-7 days regime, and 533 subjects were done compared to Rabipur 0-3-7-14-28 of 267 subjects. Novel 3-dose was non-inferior to reference vaccine, less adverse effect compared to reference vaccine, and novel 3-dose was found to be safe and immunogenic and was comparable to 5-dose of WHO pre-qualified vaccine. And for the pharmaceutical companies are rewarded for this vaccine. Thank you very much.
Thank you, Dr. सतीश सर सर डॉक्टर मनोज खोबानी सर का क्वेश्चन है कि व्हाट इज द डिफरेंस बिटवीन 5 डोज एंड 3 डोज करंट चैलेंजेस
Complete post-exposure prophylaxis is necessary to prevent the rabies in all the animals victim. It is essential for the bite victim to complete the full course of vaccination. The compliance to the anti-rabies vaccination for the post-exposure prophylaxis is only 60% and is cause of concern as animals bite victim who do not complete the full course of vaccination are still at risk of developing rabies. The novel 3-dose recombinant rabies G protein vaccine 0-3-7 days was found to be safe and immunogenic and was comparable to 5 doses of WHO pre-qualified vaccine is simulated post-exposure prophylaxis. I have one experience that a person came with rabies who do not have any bite, but we ask retrospectively, then we find that he is taking breakfast in certain dhaba. So proper cleanness is not there in the plate. So might be saliva is going inside the ulcer side of the mouth and cause the rabies without bite also reported. So it is very important, like Chhattisgarh-like area, that this novel 3-dose vaccine is very important for prophylaxis also because of the good immunogenicity up to 100% rather than 5 dose in which immunogenicity is only 60%. Thank you. Any question?
सर डॉक्टर भानु साहू का क्वेश्चन है कि जैसे सपोज प्रेग्नेंट जो लेडी है और प्रेग्नेंट उनको अगर मान लो कोई डॉग बाइट करता है तो उस समय इंजेक्शन लगाना जरूरी है या फिर
एक्चुअली डॉग बाइट में ये सेफ रहेगा 3 नोवेल जी रिकॉम्बिनेंट टेक्निक क्योंकि हम जानते नहीं कि वो रेबीज है कि नहीं है और इसमें क्या होता है कि एक्सपोजर अगर स्ट्रीट डॉग काट रहा है तब तो फिर हमको लगाना जरूरी होगा लेकिन अगर जो इम्यूनाइज्ड डॉग है तो हम एक बार चांस ले सकते हैं लेकिन ये नोवेल 3 डोज वैक्सीन सेफ है क्योंकि अर्लियर जो वैक्सीन थे पहले के उसमें हेमीप्लेजिया तक होने के चांस रहते थे और एबॉर्शन होने के चांस रहते थे। लेकिन इस वैक्सीन का जो रिकॉम्बिनेंट टेक्निक से बनाया गया है, इसमें चांसेस बहुत कम है, लेकिन हमको रिस्क तो लेना ही पड़ेगा क्योंकि हम जानते नहीं कि वो डॉग इम्यूनाइज हुआ है कि नहीं हुआ है। अदरवाइज वी हैव टू वेट एंड सी दैट अगर वो डॉग एक्सपायर हो जाता है तो हमको उसके बाद भी देना पड़ेगा। क्योंकि चाहे बच्चा सरवाइव करता है या नहीं करता है वो मैटर नहीं है, लेकिन मदर को बचाने के लिए हमको करना ही पड़ेगा। लेकिन टोटल ऑल ये वैक्सीन बहुत ही सेफ है, हम दे सकते हैं।
सर आपके क्लिनिकल एक्सपीरियंस में
जी।
जैसे और क्या क्या एक्सपीरियंस है अपनी वो फाइंड आउट किया है सर कि मतलब आपके क्लिनिकल प्रैक्टिस में सर रेबीज से रिलेटेड।
जो क्लिनिकल प्रैक्टिस में मैंने पहले तो हम लोग प्रोटीन इंजेक्शन का देखते थे और हेमीप्लेजिया बहुत होता था उससे। और पहले तो इवन उस डॉग का मतलब हेड एम्पुटेट करके ब्रेन निकाल के उसको सागर लेबोरेटरी भेजते थे, नेग्रिस बॉडी डिटेक्ट करते थे और बड़ा लंबा प्रोसीजर था और उसमें साइड इफेक्ट बहुत होते थे। और उसके बाद 5 डोज में भी क्या है, चांसेस बहुत होता था और कई लोग टाइम से आते नहीं थे, चले जाते थे और उसके बाद क्या होता था कि उसमें प्रॉब्लम और बढ़ जाते थे। तो इम्यूनोग्लोबुलिन कवरेज भी नहीं होता था, कई लोग इम्यूनोग्लोबुलिन कवरेज भी नहीं करते थे और फिर से हमको देखना पड़ता था उसका लेवल 0.5 इंटरनेशनल यूनिट से कम तो नहीं है। अगर 0.5 इंटरनेशनल यूनिट से एंटीबॉडी लेवल कम है तो अगेन हमको फिर से देना पड़ता था कंप्लीट पोस्ट प्रोफाइलेक्सिस पीईपी और इम्यूनोग्लोबुलिन कवरेज में रखना पड़ता था, नहीं तो फिर से उसके चांसेस बढ़ जाते थे रेबीज। और मेरे ख्याल से इसको अपन प्रोफाइलेक्सिस में भी देते हैं 3 डोज वैक्सीन को, वो चांसेस कम हो जाएंगे विथ इम्यूनोग्लोबुलिन कवरेज। यस।
सर यस सर। और सर जैसे कोई एनिमल बाइट होता है तो उसको ट्रीटमेंट कैसे किया जाएगा सर।
एनिमल बाइट में हम जो बाइट के ज्यादा iodine if available, and as soon as possible you can take patient for the anti-rabies vaccination in the healthcare facility. But we can give the tetanus toxoid and some trypsin and chymotrypsin combination and soft tissue infection to prevent secondary life antibiotic. But immunization is very important.
सर कई जगह पे ऐसा सुनने आता है कि मतलब छोटे बच्चे को मल्टीपल बाइट्स हो जाती है तो उस कंडीशन में सिर्फ सर मतलब जो नॉर्मल वैक्सीन है वो काम करेगा या उसके साथ में इम्यूनोग्लोबिन की जरूरत पड़ेगी सर।
अगर हाई रिस्क एरिया है, कैटेगरी 3 है, तो हमको इम्यूनोग्लोबुलिन देना पड़ेगा। क्योंकि क्या होता है कि अ, हमको मालूम नहीं है और रेबिस का कैसा है क्या है, तो देना पड़ सकता है। लेकिन आई थिंक दिस वैक्सीन इज सफिशिएंट, बट विथ immunization after 3 doses of immunization, not need to go for immunization prophylaxis. But for the same purpose, we can put it on option for the immunoglobulin. But that depends upon the category of the bite. This 3 doses is sufficient.
थैंक यू सर। सर आगे कोई और क्वेश्चन नहीं है सर। और सर थैंक यू सो मच डॉक्टर मिश्रा फॉर द इंफॉर्मेटिव टॉक। वी ट्रूली अप्रिशिएट योर एफर्ट्स। लास्ट बट नॉट द लीस्ट we would like to inform you that Travis has won two prestigious award in innovation category, ET India Pharma Award and Golden Globe Tiger Awards. These two awards we have received in Travis. Thank you, Dr. Misra.
बच्चों में